good morning, and happy Monday. I'm starting the week again. I know you are not looking forward to Monday. Happy Friday. It's Friday. Hoo-hoo. I know you've been having a wonderful time raising baby, and baby is growing and developing so well. So today I want to talk with you about your baby's vision. Your baby's vision. I think the last time we met, we talked about hearing. And so let's look at vision. What does the CDC say about vision and what your child should be able to see and what a good vision examination or eye examination should do, and when these things should be done, when the examination should be done, and how, if your child has a vision problem, how it may impact your child, and what we can do to ensure that you have a healthy vision, your child has a healthy vision. All right, so your child uses his or her vision to take in information. That's what we do. And people who have difficulty with seeing tend to develop the other senses to help them. But, your vision also plays a very important role in your baby's development. And if your child has vision problems that are not corrected, these problems can affect your child's ability to learn at their highest potential. So, it is recommended that your child have a routine eye exam to make sure that the eyes are healthy and are able to do what they are intended to do. In the United States, 1 in 4 preschool age children have conditions that are related to vision problems that are undiagnosed or untreated. And because of that, they have difficulties with learning. Now, if you were to, according to the CDC, begin at an early age with evaluating your child's vision, then you will be able to identify what problems your child may be having, or even point out that your child has healthy vision. And so do that for your child so that your child's overall development and ability to learn is at the peak level. Now, you can do a lot of things to protect your child's vision, and we are going to talk about some of those things this morning so you are equipped to take care of your baby and raise the next generation of successful children. This is Dr. Yonnette. I work as an occupational therapist, been doing this for a number of years, and as I talk with you each morning, I share information that is research-based and that is applicable to you raising your baby to be successful in this community. Now, let's look at vision screens and eye exams. As your child grows, the eyes will change quickly, and your child's doctor will help to screen your child's vision when he or she goes for the regular checkup. If they find that there are problems with vision, they may end up recommending an eye doctor so that your child can get a comprehensive eye exam. Now, although it's important for a vision screening and an eye exam to be done, they are not the same. I want you to keep that in mind. A vision screening is just a quick look, a quick evaluation that is done. And it can be done by your child's doctor or a nurse or even a healthcare provider, professional. But it doesn't identify problems that your child may have, and it doesn't diagnose the exact problem. So when you do a comprehensive eye exam. There is where an ophthalmologist or an optometrist may work with your child to do this examination and then identify or diagnose your child's medical problems so that treatment can be provided. So a vision screen should not take the place of a comprehensive eye exam. If your child passes the vision screening, then they should also see a doctor at least once a year to check with the overall development of the eyes. And then if you have any concerns, like I always say, ask your child's doctor to make sure that the detection is done early and the treatment can be provided. Here are some common problems that children with vision problems may have. They may have refractive errors, and this is when the eye condition includes myopia or nearsightedness, or hyperopia, which is farsightedness, or astigmatism, astigmatism, which is when the cornea or the lens has a different shape than usual. Then your child may also have what we call lazy eye or amblyopia or lazy eye. Like I said, this eye condition occurs when the vision in one eye is reduced because of a communication error between the brain, and then it affects the eye. Your child may have strabismus, which is crossed eye, and this condition can also affect one or both of the eyes. And then your child may have convergence insufficiency, and this is where the eye condition affects how the eye works together when looking at an object. So if you notice your child is squinting, rubbing his or her eyes, having trouble concentrating, or complaining of headaches after doing schoolwork, make an appointment with your eye doctor. And then have your eye doctor check to see what are some of the problems that your child is experiencing. Now, you can protect your child's vision. As much as possible, you should work towards making sure that your child has a healthy vision. So your eye exams at every age and life stage can help your vision to keep strong. You can also do the following to help your child's vision. Give your child a healthy diet with lots of fruits and vegetables to protect his vision. So your diet is very important. Second, I say this all the time, limit screen time. Limit your child's screen time. And none of my babies should be looking at the screen right now until they're about 2 years of age. 2 years of age. Remember, 2 before any screen time should begin. Because increased screen time can make uncorrected vision problems worse. You want to help your child to sleep. Give your child enough sleep so that their bodies can heal and recharge and develop well. Then you want to give your child opportunities to spend time outdoors. Hours each day doing near vision activities will affect your vision quality or your vision development. Just let your child go outside and see things from far away, move around outdoors and throw the ball. And then that being outside would also add the vitamin D from the sun, which would help with overall physical and chemical development in the child. Wear glasses. Spending time outdoors has many health benefits, but you must protect your eyes. You all know that none of us should be looking directly at the sun. You want to use protective eye gear if your child is out there playing sports, protect those eyes, and then get regular eye exams. Get regular eye exams so that you can keep track of how your child's vision is developing. Lots to take in this morning. But you know what? We are on a mission, and we are making sure that on our mission, we are providing the best ever opportunities for our children, for our babies, so that they can grow and develop well. You know, sometimes we neglect to see or even consider that these areas that of vision and hearing and can be impacted, you know, and it's only until we get to grade level school that we find out that a child is not seeing well. But here today we are talking about providing these opportunities for your child to be assessed when in terms of his or her vision, so that we can address, if your child has a situation, we can address those situations or that situation early. I am so pleased that you joined me this morning as we have talked about vision and how to keep your child healthy in terms of his or her vision. I know that you are enjoying raising your child, and some children are heading fast and quickly to the first year of life. And I would love to continue to see your pictures and the way your child has been developing. Shoot me your questions, and I'll work with you to help raise the next generation of successful children. This is Dr. Yonnette saying, take care of baby and take care of you, as together we have fun doing this awesome job of being parents. Have a wonderful Friday.